I'm Dr. Prashant Chhajed, Senior Pulmonologist at Lilavati Hospital with special interest in interventional pulmonology and sleep disordered breathing. Pneumonia is a condition where the air sacs in our lung, which are typically filled with air, get filled with fluid, inflammatory exudate or pus. Now, what are the causes of such a thing to happen? Pneumonia can be caused by bacteria, viruses, fungi, atypical organisms, and mycobacteria such as tuberculosis. What are the risk factors which lead to the pneumonia? Age more than 65 years, a reduced immunity such as individuals on medications such as corticosteroids or immunity reducing medicines which are used to treat certain chronic diseases, individuals who have received organ transplantation, individuals who have infections which reduce the immunity such as HIV, individuals who have comorbidities such as diabetes or those with chronic diseases including chronic renal failure. Some individuals such as those who have got a stroke are also at risk of pneumonia because these individuals can have difficulties in swallowing. Similarly, individuals with Parkinson's who may have difficulty in swallowing can also get what is called as aspiration pneumonia. How is pneumonia diagnosed? Tests that are done to diagnose pneumonia are imaging, such as an X-ray or a CT scan. Certain blood tests can also indicate the presence of an infection, such as a CRP level or things like procalcitonin or galactomannan, which we look for fungal infections. These are just some to name a few. Clinical examination obviously is very important. We do cultures to document and identify which bug is causing the pneumonia, and these cultures can be performed on tissue specimens such as sputum, blood, or sometimes a bronchoalveolar lavage where a sample is taken from the lungs and sent for culture tests. The treatment for pneumonia can be done on an outpatient basis if the individual is stable, has a pneumonia which is not very severe and can be treated with oral antibiotics or even oral antiviral agents depending on the cause of the pneumonia. Certain individuals need to be hospitalized for IV antibiotics, and certain individuals who have a very severe form of pneumonia may need, along with that, oxygen therapy, supported ventilation such as a non-invasive ventilation, and a few patients may also need mechanical ventilation. What are the ways to prevent pneumonia? Vaccinations form important measures such as influenza vaccine or rather influenza vaccine and pneumococcal vaccine, both of which may be indicated in individuals who are at a high risk of getting pneumonia.